In essence, the formation of the Community Behavioral Health Association 20 years ago was a recognition that we could accomplish more collectively together as a group than we could as individual centers. Since the start of the Community Behavioral Health Association 20 years ago, we've consistently provided services to 40 to 50,000 people a year. So one of the things that we're experiencing, we've been experiencing with CBA since the pandemic has started, is a recognition that we've always encouraged for 20 years that it's important to accept responsibility and come forward to get help. The challenge that we faced with the pandemic is the demand has increased so significantly that it's difficult for us to keep up with the demand, to have sufficient number of providers to meet that demand. Recognition, there's no other organization in the state like the Community Behavioral Health Association that provides 24 hours a day, 7 days a week emergency services for any person in the community that's in crisis, either if they're of a harm to themselves or to others. So that's one example of how our system of care is built on, and that's why it requires sufficient funding to ensure that these services are available across the state. So what I can say is that over the course of the last 20 years, I am so proud of the fact that we've been able to stay the course for the entire time to ensure, and working in partnership with the legislature and the governor's office, to ensure the necessary resources have been directed to the mission of CBA.